Yes, thank you very much. I imagine that you can now see my presentation on the screens.
Yes, I see.
First of all, maybe a bit of background about myself so that you know who is talking to you. My name is Carlos Rivera. I work for the European Patent Office. As a background, I am an engineer, and I've been working for the European Patent Office now for almost 20 years. And currently, I lead a team working in the field of healthcare informatics or smart health. And it is actually a pleasure for me to talk about this field, about smart health today, not only because this is the field that my team and I deal with every day, but because, as we will see in the next 20 minutes, this field addresses the issues and the needs that our healthcare system face. But before we start, just allow me to say a few words about the missions and the values of the European Patent Office. As you may know, the European Patent Office is the patent granting authority in Europe, and we provide patent protection for inventions in up to 40 European countries on the basis of one single application. And as the Patent Office for Europe, we are proud to deliver high quality patents and efficient services that foster innovation, competitiveness, and economic growth. And events like today's event, wonderfully organized by the Latvian Patent Office, are an important contribution to the shared goal of the European IP community, since they raise awareness about how IP can contribute to bringing our society farther. And in addition to our mission, we also aim to achieve our vision of the patent office of the future, the patent office that we aspire to be. And this is an office that in itself is sustainable for the years to come, but also an office that by supporting innovation contributes to a smarter, safer, and more sustainable world. And I gladly invite you to find more information about the European Patent Office and our initiatives in this respect at our internet site, epo.org. But now let's move on into today's topic. And let me start with an overview of the top 10 fields by number of applications in order to set the ground. We see that medical technology, which encompasses medical devices, was second in the number of filings, only after digital communication, and by not a big number of applications. And the graph also shows that computer technology followed closely and that these top 3 fields continue growing. By the way, among these top 10 fields, we also see, for example, pharmaceuticals or biotechnology, which are closely related to today's topic, or directly related to today's topics. But in fact, if you think about smart health, you will realize that the inventions in this area of the technology are actually the result of the combination of these top 3 fields. And this reflects well the tremendous growth that smart health has been following in the last years, and that it's still experimenting. So it is a big growing field, and we will see the reasons why. And actually, innovation in a particular field usually responds to the need of society. So we can ask ourselves, what is smart health attempting to solve? And in my opinion, the answer to this question can be found in the evolution of healthcare expenditure over the last 50 years. So the graph that you see on the screen shows how healthcare expenditure has evolved as percentage of the GDP in different countries. And we can see that there is a significant increasing trend that continues also today, even if this graph is a bit older. And this, of course, poses a problem to the finances of states and individuals, which can be addressed in mainly 2 ways: via cutting pharmaceutical or staff costs, which would probably result or would certainly result in a worsening of service, or via technology. So the question is, can technology provide solutions to improve the quality of healthcare services, keeping the costs under control, while increasing the user satisfaction? And I would say that the answer is yes. And I also hope that the answer is yes. And one of the indicators is the penetration of new technologies in the field of healthcare. We have here a plot of the evolution of patent applications dealing with artificial intelligence in healthcare. In red, it shows the yearly numbers, and in gray, the cumulative figures. And we can see an exponential growth in the presence of artificial intelligence in healthcare inventions. And in the coming slides, we will talk about concrete examples about how this technology is changing healthcare and it's changing the way that we're going to experience healthcare. The influence and the penetration of these technologies, these new technologies in healthcare, results in a move from a more reactive healthcare system where somebody had a certain illness and was then treated for it, to a more preventive healthcare, where we try to anticipate the onset of certain illnesses in order to be able to have a preventive effect and not only a reactive effect. Then we also move, and we have seen this during the pandemic, we move from a face-to-face presential medicine to an increase of telemedicine. And we also move, I think at this point is rather important, from a punctual follow-up, so where the doctor has values of the patient when the patient goes into a health center and gets his values taken or her values taken, to a continuous follow-up whereby we continuously send medical data to medical servers via the smartwatches or via the smart clothing that we have and that have sensors embedded into that. So this allows a continuous follow-up of a patient and not just this punctual follow-up whenever the patient actually goes to a health center. Then we're also moving from a human diagnosis to an AI-supported diagnosis. And we are moving from standard treatments that are the same for every patient to a personalization of the treatments in order to try to provide to the patient the treatment that matches best his or her profile. And now I will go over the three main areas where we see changes or where we see many applications. What would be more on the administrative side, another one more on the diagnostic side, and the third one on the treatment side. So starting with the administrative side, we see applications which attempt to facilitate the administrative task. We see applications which deal with automatized scheduling, automatized generation of medical reports, and this, of course, frees time from the medical personnel so that the medical personnel can then focus on the patients. We see also applications focusing on the optimization of resources. It could be the beds of a hospital, it could be the medical devices, or it could be the instruments. Sometimes also the optimization of the personnel, of the medical personnel, medical staff, depending on where they are located within a medical environment. Also applications predicting the admission risk and the length of hospital stay so that we can anticipate what's going to be the occupancy depending on certain illnesses or certain waves that might come. On the side of artificial intelligence, we see applications aiming at extracting information from plain text, for example, from the notes of a doctor, and generating reports on the basis of those. We also see application anonymizing patient data, and I will mention that later because this is an important part when we talk about data, when we talk about patient data. We see also applications aiming to collect and provide the patient dossier information to the doctor when needed and with the information needed. Like that, the doctor, when seeing actually a patient will have all the information in front of his or her eyes and will be able to duly and more professionally, or more, let's say, with more information, address the patient that has in front of his or her. Another one could be also these voice or chatbots for frequently asked questions when patients are calling a hospital, where in certain occasions the patient will not even notice that he or she is not talking to an actual person, but just to a bot. And something that I also find interesting is voice analysis to prioritize attention. For example, imagine an elderly person calling a call center of a hospital. If the system detects that it's an elderly person, or if a system detects that it's a person who is under stress, this call might have priority over other calls. And this will improve, of course, the experience of the users and the service provided. From the diagnostic side, as I mentioned, we have now more sensors in watches, in clothing, that can provide continuous medical data. And we also see many healthcare systems supporting or covering the apps or the cost of the apps in order to provide a better service to their customers or to the citizens. Then we have the issue of artificial intelligence directly issuing health recommendations to the user or to a doctor, or health diagnosis. And here we have the particularity that there is a line who has the liability. So is the doctor who's giving the diagnosis? Is a machine giving the diagnosis? In which cases can a machine provide a diagnosis? So I think this is an interesting topic, not so much for the IP world, but more for the legislative world. Other applications deal with the filtering of symptoms. So filtering the symptoms in advance and then sorting the patient in view of the symptoms to a general practitioner, to primary care, or right away to a hospital, and avoiding that that a patient goes first to one center and then is then routed to another one because his or her case requires more or less attention. A very important field in diagnosis is image analysis in radiology, dermatology, and ophthalmology. Artificial intelligence is currently now already in a position to better identify tumors or problems in medical images than the human eye. And also, it can also do that with lower resolution X-ray images, which means that the patient can then receive a lower irradiation. And then providing diagnosis based on big data of previous patients. So you could have a certain patient having a certain biological measurements, and then those biological measurements will be introduced into a machine learning algorithm. The machine learning will have been trained with medical data from thousands of other patients, and on the basis of the medical data of the new patient will be able to determine a certain diagnosis. And here is where this anonymization of data comes. In order for artificial intelligence, for machine learning to properly work, it has to be well trained. In order to be well trained, we need huge amounts of data. And this, in particular in the medical field, it is important that this data is anonymized so that then it can be freely used. Then for how to improve therapy, or what applications do we receive for improving therapy? Well, we see termination of therapies based on big data, the same as we saw for diagnosis, looking into which therapies had been applied to 1,000 other patients and how the results were for these patients. We can then determine on the basis of a particular profile of a new patient which is the treatment that will most probably perform better with this new patient. We can monitor therapy compliance. There are chronic patients that need continuous therapy, and sometimes they might forget the one or the other treatment. And we can provide Yes, and that's basically also what the last point says. So, of course, every innovation in this field, or not every innovation, but many innovations in this field go through the patenting processing. And we have here a case, an example that I just want to show you of how technology does end up improving the way we experience healthcare and how patents application are in the way. So here in this application, it was related to pill. So it's actually a friendly robot kind of that supports people following maybe a chronic disease and who have to take regularly medication, or are elderly people who need to take regularly medication, and they have this friendly robot at home. So this patent application was filed via the PCT and then resulted in an EP European application. And the application related to pill management within the device, to how to control the operation of the device, how to issue alerts to the user or to caretakers related to schedules of medication, and to the exchange of data with telehealth providers or other healthcare services. And so such an application is a clear example of how technology can improve the life of, for example, these elderly people or these people with chronic diseases that regularly need to take medication. But the penetration of this new technology does not only bring new innovations, it also brought the need to incorporate new professionals to the healthcare sector. I mean, it's not enough with the with the doctors, or it's not enough with the engineers who design the medical devices. Now we have these data scientists, we have the AI engineers, data governance experts, data entry experts, data engineers. So the people that have to see which algorithms could be used, the people that have to watch out that these algorithms are duly trained, the people that have to gather the data, that have to make sure that the data complies with all the norms that need to comply from a legal point of view. It needs the engineers then to interpret and to train also the doctors to make use of that data. And it needs a chief AI officer, which might promote, which might, let's say, support the whole process of integration of these new inventions, of these new technologies in our healthcare services. And with this, my presentation is now over. There is something that I did not go in detail because, well, I didn't really go into it because it will take us probably a whole day, is patenting in this field. But I will say a couple of words, and that's mainly inventions in this field can be patented. But as always, there must be a technical effect in these algorithms that we use when patenting inventions. So if your invention merely lies with, let's say, a business-related goal, an administrative-related goal, for example, how to bill a patient after a treatment, that would rather not be eligible for a patent because it would have more a business purpose and not a technical purpose. And now I will be happy to take any questions.
Thank you, Carlos. It was a very interesting presentation, and actually you touched interesting point for me as well. Think about this liability regarding the automation. I think every industry who is applying AI is struggling with this, because also like in transportation, with automated driving, right, who will be responsible? Either the programmer who built the autonomous driver or the driver itself. So, but yeah, that was a very interesting point for me. Just a couple of questions here. I saw this exponential growth of the patent applications. The question is how it is followed by actually the approvals of the patents. Is that how is can we see also the increase there, or any specific data?
Yeah. Well, first of all, let's say the office has needed to adapt to this increase in this kind of applications, and the number of examiners working in this field has increased a lot in the past, and will continue increasing, because otherwise we could not deal with this let's say wave for application of this penetration of the technology, of the new technologies into the medical field. And so of course, the more applications we treat, or the more applications that coming, of course, is also increases the number of grants in this field. We apply the law, we apply the European Patent Convention, and what deserves a patent will get a patent.
Thank you. And the other question here is, what do you see when you go through these applications? What are the challenges the companies face? Maybe some common mistakes to be avoided. One you already mentioned, so it will be like business-related goals. So it then this technology might not be granted as the solution, might not be granted the patent. Maybe there's something else the others can learn before they start the process.
Yeah. So as with every application, it is very important that it is well drafted from the beginning, so that the application, the patent application from day one, contains all the information that may be used later on during the prosecution of the patent application. The reason being, and many might know this, is that later on you cannot add information into that application. So whatever was not there from the beginning, you will not be able to make use of it in order to bring your application forward. And this is important because often the starting set of claims, so which define the scope of protection, might not be patentable from the very beginning. So you might need to specify a bit more the algorithms that you are using in this kind of applications, in order to have what we call a link between these algorithms and the technical effect that your application is solving. And in order to be able to add these details to the initial claims, you will have to have support for these details in your originally drafted application. So my recommendation is make sure that the originally drafted application is well written and contains the details that you might need to make use of later in the prosecution.
Thank you for reply. I guess if there are any questions in the audience, maybe. Oh, okay. So we have also incoming questions here. So the question one is here. So who are the main applicants? Pharmaceutical companies, universities, and what you see there?
Yeah. So it is, I must say that it is a field where there is quite a significant startup ecosystem, I guess because of the relation with IT. But what we have also seen is big players from the pharma industry creating new departments within their structures in order to deal with this new technology. Of course, these big pharma or these big players in the medical industry, they already had their medical devices, so they could eventually have access to data, to patient data that, when duly anonymized, when duly formatted, can then be used for additional applications or for additional diagnostics or treatments that were maybe originally not thought of when they developed the devices. So we see also penetration of these technologies into the big, well-established companies, as well as into the startup ecosystem or universities ecosystems.
Okay, thank you. And the other one question: what could be the possible risks if you are introducing AI in carrying out of the administrative tasks? Basically, what are the risks if you implement AI for your administrative tasks? Yeah.
Well, let's say, of course, the risk. You're probably asking from a patenting point of view. If it's from the patenting point of view, if the effect of your invention by implementing AI into an administrative task remains at this administrative level or logistic level or let's say more business related level. So it could be that the examiner tells you, look, your invention does not have a technical effect and therefore it cannot be patented. However, there could be inventions based on artificial intelligence where the invention relies on the technical implementation. So I don't know, it could be, just to give an example, it could be that the invention is about administrative purposes, but in your invention, you have, for example, the treatment of certain data being done by the graphic processing unit, whereas the treatment of less complicated data is done by the central processing unit. So here we would be talking of a technical implementation which will have a technical effect. So, yeah, just to wrap up, although in general, business-related inventions will not be patentable, it could be that the invention, although business-related, relates on a technical implementation, which, if being new and inventive, might still lead to a patent.
Thank you. For the next question, I would kindly ask you if you could switch the language channel. I will read it in Latvian because I don't want to be mistaken in the translation. So just.
I have it in English.
Good? Okay. So, jautājums būs tāds, varbūt var pastāstīt par uzturbagātinātāju sastāvu patentēšanas iespējām, kā ražotājs var sevi pasargāt vismaz uz pāris gadiem.
Well, I'm sorry because food additives is completely out of my field of expertise, so I'm afraid that I cannot address this question.
Okay, thank you. It's okay. Thank you very much. And still, we have another one, and we have time for another one. Do you expect a decrease of applications in the area of health because of the war in Ukraine, or maybe increase? So, do you see any trends or correlations there?
Hard to say. I mean, it's difficult to say how crises affect. We have tried in the past to make predictions how more financial crises affect the filings, and we have always seen that the predictions actually did not turn to be right. So when we thought it was going to go down, they actually went up. How it's going to be with Ukraine, I think it's also very difficult to assess.
Okay, let's hope still everything will continue to innovate and continue to apply for the patents. Carlos, thank you very much for your time and your replies and for the presentation. It was nice seeing you here. And now I will bid you goodbye.
Thank you. A pleasure to be with you.
Yes, thank you.